Chairman, members of the Select Committee, I welcome this opportunity to address you all on the revised estimates for 2021 for my department, which is vote 38. Unlike other votes, the health vote is not configured along programme lines. My department continues to work towards the development of programme budgeting and changing the structure of the health votes to reflect this. It's going to take some time as financial systems in the HSE have to be adapted to allow for this in the context of a financial reform programme that's currently underway. In line with government policy and in the context of COVID-19, Budget 2021 provided an unprecedented level of investment. The investment supports the resilience and preparedness of the health service to increase capacity and permanent staffing levels, to progress the implementation of a number of national strategies, and of course to advance the Sláintecare vision of universal healthcare. I'm delighted to have secured a further €4.039 billion in funding on top of the 2020 allocation. The level of funding provided will enable the advancement of a number of important priorities this year, including the protection of vulnerable groups, service users, patients, healthcare workers and the wider public in the face of COVID-19 in line with the national and international public health guidance, the delivery of increased levels of healthcare to our people in community and primary care settings, encompassing the mainstreaming of the Sláintecare Integration Fund initiatives, the delivery of the ambitious capacity enhancement and reform plan in line with the health service capacity review of 2018, improving access to mental health services, including progressing the implementation of sharing the vision, improving access and enhancing specialist disability services with a focus on implementation of the Transforming Lives programme. Continuing projects including the development and adoption of an integrated financial management system by all statutory and larger executive funded voluntary services, alongside further development of activity-based funding for hospitals and community services, together with enhancing procurement governance and systems. The provision for the health vote in the 2021 revised estimates allows for a significant expansion of the health sector workforce with an increase of 16,000 whole-time equivalents over the original January 2020 estimate of public service numbers. The allocated pay budget has increased from €7.95 billion to €9.055 billion in 2021. The impact of the latest COVID-19 surge in the first quarter of this year has had an obvious impact on service delivery. Some areas, such as additional home support hours, are behind where we would have hoped they've been at this point, but the HSE is working to bring these back on track. Demand for the nursing home support scheme is also down on estimates, but this has not impacted on waiting times for applicants. It's expected that all things remaining as they are, certain pent-up demand will see expenditure reach estimated levels by the end of the year. The Health Act 1947 was amended to provide for a system of mandatory quarantine at designated facilities. The system of mandatory hotel quarantine is necessary to prevent and mitigate the risk of COVID-19 and particularly the variants of concern. The government has established a proportionate and carefully balanced system for mandatory quarantine, which is necessary to address the risk posed by travel from states where there is known to be sustained human transmission of COVID-19 and in particular variants of concern, or from which there is a high risk of importation of infection or contamination with COVID-19 and again in particular variants of concern. This is necessary to protect public health, our health system and our vaccination programme. The cost of mandatory quarantine was originally estimated in the region of €7 million, with costs to be recouped from people placed in quarantine. However, as further capacity and hotels have been added, this estimate will inevitably increase. Funding to meet these costs is being provided for from within the departmental allocation and will not impact on the allocation to the HSE. The Programme for Government reaffirmed its support for universal healthcare via Sláintecare. Sláintecare is being funded and is on track to improve access, expand eligibility, improve the patient experience and bring care closer to home. In 2021, there is continued commitment to Sláintecare with €1.353 billion being provided to fund the Sláintecare reforms, including increased acute and community bed capacity, providing enhanced community, social and primary care services, and improving access to care, including a new Access to Care fund. The move to a public-only health system is a priority for government and central to the vision of universal healthcare. The programme for government provides for the introduction of the Sláinte Care contract. Arrangements are currently being finalised to facilitate the introduction of the contract in the coming months, following the enactment of the Public Service Pay Bill 2020, currently referred for committee stage. My officials will be writing to the representative body shortly, inviting them to discussions on the contract. There has been significant growth in consultant numbers recently, with numbers increasing by over 200 in the course of last year to currently 3,470. However, I recognise that further progress is required. I want doctors to stay in the Irish health system and for those who have emigrated to return home. As part of Budget 2021, nearly 600 additional consultant posts are being created. The introduction of the Sláinte Care contract will give us an opportunity to grow consultant numbers and move towards universal healthcare in a public-only system. The introduction of the Sláinte Care contract also represents a significant opportunity to address the current number of temporary and unfilled consultant posts, and I've requested the HSC to develop a plan to achieve this. Following intensive engagement, my department, the Health Service Executive and the Irish Medical Organisation have reached an historic agreement to the introduction of a fundamentally reformed and strengthened model for public health in Ireland, in line with international best practice. This will require implementation of the consultant-led and consultant-delivered public health model. Implementation of this model will enable recruitment and retention of public health consultants. It will deliver an agile, dynamic, intelligence-led public health medicine service to protect the population from health threats, promote health, improve health services, and really importantly, tackle the many existing health inequalities or inequalities in health we have in Ireland. Women's health is a priority for this government. Commitments made in the programme for government include specific support for the Women's Health Task Force and the development of a Women's Health Action Plan. Budget 2021 allocated a dedicated multi-annual €5 million Women's Health Fund to implement a programme of actions from the work of the Women's Health Task Force, and appropriate activity is being identified for implementation and funding. The first two funded proposals, which have just announced last week actually, are €1.4 million for two community-based ambulatory gynaecology services governed by Tala University Hospital and University Maternity Hospital in Limerick, and €0.6 million for the expansion of the endometriosis service at Tala University Hospital, essentially the creation of a specialist service for very complex cases. These proposals will significantly increase access to these services for women and support their care at the earliest point. €20 million is being provided to address the implementation of the National Cancer Strategy, including surgical medical oncology, rapid access clinics and early diagnosis, and radiotherapy. The National Cancer Control Programme is allocating initial once-off funding to each hospital group to assist with the costs associated with their efforts in service recovery and continuity. This funding will support measures to increase resilience and address clinical backlogs. I want to talk now about the 2020 outturn. The gross provision for the health vote in 2020 was €20.875 billion, comprising €19.801 billion current expenditure and €1.074 billion capital expenditure. This €20.875 billion represents the gross funding position for both the Department of Health and the HSC, and it includes additional funding of €1.777 billion made available for current expenditure in 2020 in response to COVID-19, and €547.5 million granted by means of a supplementary estimate. The initial 2020 capital allocation was €854 million. In response to COVID-19, an additional allocation of €220 million was made available, bringing the total capital allocation last year to €1.074 billion. The total cost of COVID-19 supports provided by government to the health service last year was €2.5 billion. Among the measures covered by this expenditure was testing and tracing, supporting nursing homes and home support, enhanced GP services, community assessment hubs, caring for people in acute services, private hospital capacity, expanding and protecting our health workforce and essential workers, expanding physical infrastructure, including isolation facilities, and maintaining access to essential health products, equipment, and services. These measures continue to be relevant in 2021 as the pandemic continues. Turning now to the 2021 budget. In framing the 2021 budget, the Oireachtas allocated significant further additional exchequer funding for the health sector, and I'd like to thank the committee members for their support in this. In 2021, gross health funding is €22.13 billion. This comprises €21.081 billion in current expenditure and €1.048 billion in capital expenditure. It represents an increase of €1.28 billion, which is 6.5% on the 2020 post-supplementary estimate current expenditure budget, and recognises the government's commitment to providing a health service that seeks to improve the health and well-being of the people of Ireland. While the 2021 capital allocation is €26 million below that of the final 2020 figure, it represents a significant increase on the pre-COVID-19 allocations and reflects continuing investment to meet infrastructural challenges in responding to the pandemic. The capital funding for health in 2021 will contribute to the delivery of modern health facilities and equipment to improve and expand service provision and capacity across the country, both aspects of Sláinte Care and Project Ireland 2040. While the scale of this funding is significant, the value of the investment in protecting our people in the face of COVID-19 is unquantifiable. The government is steadfast in our commitment to protecting everyone and to enhancing the resilience of our health services. This commitment is evident in the level of funding available in the 2021 budget. The issue of health funding is a major policy challenge internationally, as I know committee members are very well aware. Despite welcome funding increases over recent years, the need for effective financial management remains crucial. The health service is dealing with a larger and older population with more acute health and social care requirements, increased demand for new and existing drugs, and the rising cost of health technology. The costs associated with these service pressures will increasingly need to be managed, not solely through annual increased exchequer allocations, but also through improved efficiencies, productivity, and value from within the funding base in 2021 and beyond. Demographic pressures, including a rise in chronic diseases and ageing populations, are major challenges to health funding internationally and here at home as well. The additional funding secured over recent years provides a substantial basis for the health service to maximise the level and quality of service delivery while also implementing the Sláinte Care programme. In conclusion, a significant increase in funding for the health services has been achieved this year. Much of the recent increase has been COVID-19 related. The health system responded quickly and efficiently to the COVID-19 emergency. Additional spending has facilitated the necessary and rapid introduction of testing, provision of essential PPE, enhanced support to critical health services, and the introduction of additional hospital capacity and community services. Oversight structures are in place to ensure that the significant investment is approved, monitored and reported in line with agreed sanctioning processes and financial procedures. The programme for government places a major focus on health service reform and investment in our public health system. Building upon and learning from the COVID-19 response is central to the government's approach. In addition to COVID-19, dealing with a growing and ageing population, more acute health and social care requirements, increased demand for new and existing drugs, and the rising cost of health technology will all continue to pose a financial challenge into the future. Improving the way services are organised and delivered and reducing costs in order to maximise the ability of the health service to respond to growing needs must remain one of our important focuses. It's essential that those managing and delivering the service continue to demonstrate good practice by delivering the best possible healthcare within the limits of resources that have been made available by government in the year ahead. Thank you, colleagues, and thank you, Chairman.
Thank you, Minister. We've agreed to give 15 minutes to our first three lead speakers, different groups, Fine Gael, Sinn Féin, Fianna Fáil, 15 minutes. So our first group of speakers is Colin Burke and Bernard Durkin. I believe you're sharing time.
Bernard, do you want to go first, Bernard? Sorry, Bernard's not there. It says.
Go ahead. Yourself, Colin, will you, please?
Yeah, thanks very much, Minister, and thank you for the presentation. Can I just touch on one or two issues? The first one in relation to additional funding was provided in relation to the private nursing homes to deal with the pandemic. I'm just wondering, in relation to the public nursing homes and the community hospitals, and I think there's 119 of them. I don't see any figure in there give us a breakdown of what additional funding had to be spent, and in particular about bringing them up to a level of care that can, so that they can now deal with the new demands that are there, the new challenges that are posed by COVID. And I'm just wondering, Minister, if we can get a breakdown of that figure. The second issue I just wanted to touch on is about expansion of home care. And I suppose one of the things that the pandemic brought out was that, it now creates new demands. As you said yourself, we have a growing, the number of people over 65 is going to continue to grow over the next 10 years. I think it's about 720,000 now, it'll be 1 million by 2030. And I'm just wondering, in relation to the rollout of additional home care supports, and about the regulation of the home care providers, what progress is going to be made in that over the next, during 2021. And the final thing I just want to touch on for the moment is this one in relation to Sláintecare, and you've referred to Sláintecare quite a bit, but Sláintecare have produced a report in relation to the 3 elective hospitals for Cork, Galway and Dublin, and it's a totally watered down proposal now, and I'm getting no response from anyone as regards where we're going in this. We put in huge money into new healthcare facilities in Dublin. Cork has grown its population by 130,000 over the last number of years. No new hospital beds, and now we have a Sláintecare report suggesting that all we should have is a day facility which couldn't cater for anyone with, say, diabetes, anyone with other underlying conditions. A day hospital wouldn't be able to deal with that. And I'm just wondering, where are we going with this Sláintecare report, and where is their provision in the current budget for 2021 in relation to dealing with those issues?
Thank you very much, Deputy, for those questions. In terms of the public nursing home supports, I'll ask that a note is provided to you. Obviously, there was a substantial amount of support provided to the nursing homes right across the country, which was supported by Nursing Homes Ireland. Specifically with regard to the public nursing homes, what I'll get is a detailed note just on the money, but on the additional capacity that was provided from the CHOs. In terms of expansion of home care, we have a very ambitious target for this year, which is to add an additional 5 million hours. So 150 million in additional expenditure was allocated. It was 140 million for provision of those hours, and then 10 million for the provision of what's called the inter-array system. So we are fundamentally changing how home care is provided in the country. The inter-array system will essentially allow for an individual assessment of the needs that people have and the provision of care that they need. There's many advantages to it, including around transparency. But one of the things that I'm very keen on is it helps in terms of health equality. Making sure, and it will allow us to look at what parts of the country have the level of service provision they need, and which ones don't and need additional support. And then specifically, you mentioned regulation. I actually brought a memo to government today. We got agreement today for the drafting of heads of bill for the regulation of home care. So a really, really important move. Obviously, there's a big focus. I know you're not only are you very aware of, but yourself and Deputy Higgins tabled a bill on. So there was a lot of progress today in terms of we'll be drafting a very comprehensive bill around the regulation of home care services, and also then expanding it to essentially bring in line the regulation of nursing home and home care, because it needs to be more of a continuum. My own view, and I know of you shared by many on the committee, is that we need to maximise home care over nursing home care. Not that there isn't a role for nursing home care, of course there is, but to keep people at home as much as possible. So a really important step was taken today. And then on the electives, I know you have and continue to advocate very strongly in terms of the electives, including the elective hospital in Cork. And you're right in that some of the thinking by the Sláinte Care team is that the elective hospitals could be daycare only. The thinking around that is that you maximise the quality and the speed of care for less complex procedures, thereby freeing up inpatient beds in other acute centres for more complex care. However, I know there are strong views in Galway, and there are indeed strong views in Cork. And you have expressed them, and other deputies have expressed them, and indeed some of the clinical community have expressed them in terms of wanting a mixture of inpatient and daycare beds in any new elective hospital. So what I can tell you, Deputy, is no decisions have been made on that, and the thinking is still being worked on.
Minister, the point I'm raising in relation to the elective hospital, and this is a case of how long is this going to be kicked around the place, because we have a hospital, say for instance, you take the South Infirmary / Victoria University Hospital in Cork. It's a building that's there for over 150, 200 years. You can't modernise it unless you do major work in there. And either we go down that road where that work is done, or we build a new hospital on a greenfield site. And what the elective hospital being proposed by Sláinte Care is a day facility, 6 days a week, 50 weeks of the year, will not be able to deal with a huge number of patients, because a lot of patients who are coming in for minor enough procedures will also have underlying conditions. And I'm just wondering, how long will this debate go on for? Because this is now, we're into year 4 in relation to talking about elective hospitals, and with no clear plan.
Thank you, Deputy, and I share your frustration. There has been a lot of talk about these elective hospitals for a long time, and I would much prefer that we were further along. What I can tell you is that the Sláinte Care team is working hard on it. They are looking at the various sites, and they are looking at the different models of care. As I know you'll understand, a lot of this work, because of the pandemic, hasn't moved at the pace we'd all like it to move at. But your points are well made, and I will feed them back. I have done previously. I will feed them back again into the team, looking both at the sites and the model of care options for the elective hospitals.
Can I just touch on, Minister, the issue in relation to the Treatment Purchase Fund? And I suppose in talking about the Treatment Purchase Fund, I'm also talking about the Treatment Abroad Fund, which are two different things. And we know the situation where people are being encouraged to travel abroad for some medical treatment, whereas there are facilities here in the south and in the country to deal with some of those treatments that are being provided abroad. What are we doing in order to deal with this issue so that we can keep the work here and make sure that it's done in a timely manner, rather than people having to travel long distances? And I'm just wondering, Richard, Treatment Purchase Fund, is there adequate funding provided? Because the problem now with our own hospitals, they're all will be under increased pressure due to the backlog of work not done in 2020. How can we now make sure that there's catch up, in particular where there are facilities where this work can be done?
Thanks, Deputy. My view is that as much work as possible should be done within our public health system as possible. We shouldn't have the waiting lists we have. And so the question is, as we build up the capacity, the permanent capacity of the public system to be able to meet demand, what do we do about the far too many men, women and children who are still waiting? And the answer is it's a combination of things. So as you say, the Treatment Abroad scheme is used. It's something that if we had the level of capacity we should have here, that the Treatment Abroad scheme really shouldn't be needed. So let me give you an example. In Cork, funding has been provided for an ophthalmology unit, which is going to be able to deal with an awful lot of people with cataracts who are currently travelling to Northern Ireland to one or two of the private hospitals there to get their cataract operations. Success to me is that people no longer need to travel and can be treated in Cork or indeed in one of the HSE hospitals. I believe that in the short term, in order to make progress on the waiting lists, we need to use a combination of things. We do need to use treatment abroad. We need to provide additional funding to the HSE, both in terms of permanent capacity like the ophthalmology unit, but also in terms of additional short-term capacity. So, for example, running operating theatres out of normal hours, payment by procedure within the HSE hospitals, and indeed using the private system as well to basically treat as many people as we can, as quickly as we can. The total funding being allocated this year, Deputy Burke, is very substantial. So what we have is we have an access to care fund, which is €210 million. There's an additional amount to the NTPF of 30 million, bringing
they're already available, aren't they?
Sorry? No, bringing the total amount for the NTPF up to 130 million. Then there's 33 million for alternative care pathways, which is part of the Sláinte care work, but essentially will help tackle waiting lists. The acute hospital service restart fund of 35 million, and then cancer screening of 10 million. In total, that comes to about 418 million euro. So it is the intention to bring these waiting lists down as quickly as we can, really using every available mechanism we have.
But Chair, one of the problems in relation to the treatment purchase fund is where people are being sent out for assessment, the assessment comes back and then they have to be referred out again. I'm just wondering if a reform has been made in that, where people are referred out, not only are they referred out for the assessment, but also for whatever procedure that's required. And that's one of the complaints I'm getting in relation to the treatment purchase fund, that the system is too complicated and needs to be reformed.
I think you're right. We have this slightly catch-22 situation, which is you can use the NTPF if you have to wait too long for your procedure, but to use the NTPF, you have to get an assessment, which you're having to wait too long for. And it's catch-22, and too many people are left outside the system. They can't access the service they need through the HSE, and they can't access the service through the NTPF because they can't access the assessment through the HSE. So we're taking a fresh look at it this year. We're looking at the 130 million euro in the NTPF, the additional 210 million euro for the Access to Care Fund, and those other pots of money, and saying, how can we do this better? One of the things we're doing, for example, is expanding access to diagnostics as well, which is something that hasn't been available before. So I think you're entirely right, Deputy. I think the current situation can be improved on, and it is our intention to do that.
Sorry, Minister, can I just ask in relation to, you referred to the issue of consultants and the recruitment of additional consultants. Have particular areas been prioritised in that? Because I know there's a number of areas where there's now a shortage of consultants. Have those areas been prioritised? And what particular areas has the department and the HSE decided to focus on? And the second issue is in relation to the specialist registrar, the specialist, where we put in place amending legislation, people who weren't regarded as being on the specialist registrar, but the regulation has not been put in place by the department. And when is that likely to happen?
Thanks, Deputy. In response, the answer to your first question is two different things are happening. One is the HSE are hiring on an operational basis and on a clinical basis to where the high priority areas are. And secondly, there is a relatively new team within the Department of Health, which is the Workforce Planning Unit, looking to answer the question, where is the gap? So believe it or not, there isn't a model yet that tells us how many of each specialty we need, and we already know what we have, which would identify the gap. So there's a lot of work going on in the department now, again under the auspices of Sláinte Care, which is the area-based healthcare analysis, to say what do we need of each specialty in each area, what have we got, what's the gap, and that's what we hire. And I beg your pardon, Deputy, your final question, could you remind me what that was?
That's in relation to where there are certain people who weren't regarded as being on the specialist list in relation to consultants, and there was amending legislation put in place which would allow them to come on the specialist register, but the regulation has not been put in place to allow that to happen. These are consultants who are appointed but who are not regarded as being on the specialist register.
I'd need to take a look in more detail, Deputy. Are you talking about the consultants who never elected to transfer across, who've been consultants for some time but never elected to transfer across?
Yes.
Or are you talking about the new public health doctors?
No, I'm talking about people who are employed by the HSE, consultants who are employed by the HSE, where we had to bring in amending legislation because for various reasons they didn't qualify as under the specialist register scheme. Some of these are going back, were in place, who I suppose went into jobs because they were in filling positions for over a number of years, but were never on the specialist register when they were then appointed consultants.
Minister, can you come back with a note on that for us? We've gone over time on this,
Yes,
section.
No
Sorry.
okay.
I've David Cullinane coming in next.
Thank you. Welcome, Minister, and also welcome to all of your staff as well. Can I ask first of all, in relation to the headline figure, the total gross provision figure of 22.13 billion, how much of that do you anticipate will be baselined for next year as we look into budget 2022? Because obviously a portion of that is COVID related to deal with issues like testing, contact tracing, PPE equipment, quarantine and all of those measures. And I'm assuming that some of this will be with us for some time to come. It's not going to be something that will disappear anytime soon. But there may be at some point a need to scale it back. So in terms of the overall expenditure, is it your intention that you will keep that figure of 22 billion now as the baseline figure going forward into budget 2022? First question.
Thanks, Deputy. We don't have an answer to that yet. It's a really good question. As you'll be aware, the 4.039 billion breaks down into 2.121 billion for COVID measures, 1.163 million for new measures, non-COVID measures, and then there's the ELS, the existing level of service, in there at 755. So I would anticipate that the ELS stays by virtue of what it is. I would anticipate that the additional new measures, the 1.163, stay. And obviously that all has to be agreed by government, but certainly that's what I would be looking for and would be normal practice. And then the next question is, how much of the 2.121 billion COVID stays? I don't think, Deputy, at this stage we know. I think as you and I were discussing only yesterday, there will be an ongoing need for testing and tracing, for genome sequencing. There may be an ongoing need for some quarantine facilities. Certainly what the experts are telling us all is that globally COVID is going to be here for some time, no matter how well we do here in Ireland.
But my point, if I can just interject, yep. My point is, at a policy level, whatever about what the money is spent on, you could make a decision, or government could make a decision, that we have to invest more in health. We've committed this year to just over 22 billion, and some of that money then could be reprofiled to spend in other areas of healthcare, which we all know is necessary. So are you saying that decision hasn't been made yet? So it is possible that that figure of 22 billion may not be what will be in budget 2022. That's a decision that will be made later. There's no policy decision made at this point in time to baseline that figure. Is that what you're saying?
Yeah, that's right, Deputy. So two things could happen. I obviously will be pushing for additional funding for new measures. And at the same time, I hope that the funding allocated for COVID significantly reduces. Where the two of those land in net terms, we'll know later on this year.
Okay, can I move on to the briefing note that we got from the department on page 15 under acute services? It talks about 236 million additional spend on acute beds, and it says that there will be an additional 1,146 beds by the end of 2021 when compared to 2020. Can you tell me what the anticipated number of funded beds will be? What's the number of beds?
Yeah, I just want to check we're looking at the same documents. Deputy, is it 276 million you have?
236, it's page 15 of the briefing document.
Okay, in my note it's 276, but that includes 40 million in capital funding, which probably gets us to the 276 million. So I think we're talking about the same amounts.
Well, the number, let's just stick with the beds for a second. So we're told it's 1,146 additional beds. So how many of those, sorry, what would be the total number of beds, funded beds that we'll have at the end of 2021?
The latest target for the end of this year is an additional 1,063. That's acute beds now. That doesn't include the critical care
I know
beds.
that.
Yeah.
So I'm just reading from the briefing document we've got. So, I mean, if we have different documents and different numbers, it's a bit concerning. So what it says is the funding provided in 2021 will ensure that the total number of funded acute beds in the system will increase by 1,146 by the end of 2021 when compared to 2020. I've pointed this out before, Minister, and I want to point it out again. That's not correct. It's actually based on 2019 figures. So in 2019, the numbers of beds that we had was just over 10,700. And that was the baseline figure. So can I ask if that can be clarified, first of all?
Yes, absolutely. So here are the exact figures. The latest figures are that between, and I beg your pardon, you're absolutely right. The total figure we have is essentially from the 1st of January of last year. So it is 2 years worth. So the amount...
What I'm saying, Minister, is it doesn't say that in the briefing note. And if you remember, we had a discussion on this in the past. It's actually right when it comes to ICU beds, but it's wrong when it comes to acute beds. And it gives the impression that there's an additional 1,146 beds for 1 year, where in fact it's 2 years. That's all I want to clarify.
Yeah, and it's a very fair question. The reason that the department has presented it like this is because last year was a very unusual year in that a large amount of COVID funding was used to set up temporary beds. So the beds came into existence last year. Those beds were one-off beds, and what we've done this year through the budget is permanently fund those beds, right? So if you like, some of the beds, 611 of the beds were brought into existence physically last year, but only funded to the end of the year. And then through the winter plan and this budget, we've turned them into permanent beds for this year. So the total permanent beds that we are getting through this budget, which I guess is the question for us all, is
it's over a 2 year period. Yeah, and that's what I was asking.
Well, just to be clear, it's a permanent provision.
Oh, I understand.
It's 1 year permanent provision. So the answer, Deputy, is 611 from last year, and then the total for this year and that 611 is 1,063.
Perfect. Can I move, Minister, to the issue of the consulting contracts and public-only Sláinte care contracts? That was something that was meant to be in place since last June, so all new contracts were meant to be Sláinte care public-only contracts. Is that happening, and what's the take-up? And can I ask what engagement you've had with the IMO on this issue? Are they and the Irish Hospital Consultants Association buying into these Sláinte care public-only consulting contracts?
We're writing to the representative bodies now to invite them in for initial discussions. I don't want to preempt what the IMO is going to say. The IHCA obviously will have a view as well, and they have a view on various other issues which we've all discussed.
But what I was asking is, there, from your own knowledge of experience of discussions with them, is it a positive one? So are they in agreement with these contracts? Do they see it as a way forward?
Well, I know you'll appreciate this. I can't and don't want to and wouldn't presume to speak for the IMO or the IHCA. They'll give their own view. What I can say is that what we're doing is moving to the Sláinte care contract. So once this contract is in place, the only contracts that will be given out for new entrants into the HSC are the Sláinte care contracts. And critically, I think something we're all agreed on and is a core component of universal healthcare is that the new contracts will only allow for public work in public hospitals.
Okay, and I just want to move on then to a related issue, because when I talk to hospital consultants, the two-tier nature of the pay is one of them, and they want those contracts to reflect that reality. So that's one of the issues. But as important, if not more important, is the support that they get when they're in their jobs, and it's access to equipment, diagnostic equipment, and access to theatre space. So while we might have ambitious plans to increase the number of consultants, we also need to increase theatre space, because that's part of the problem. We also have to increase access to equipment, because what they tell me is that part of their struggle, part of their daily struggle and their daily work life actually involves battling the system. to get access to theatre space, access to equipment. So can I argue that while we're funding additional consultant posts, that we, in tandem with that, also look at expanding areas like theatre space and equipment so that we actually get not just bang for buck, but we also have an opportunity then to put them to full use and actually reduce wait times?
Yeah, I couldn't agree more. So the whole approach is we create the new Sláinte Care contract, but to your point, that's not enough. And I'd like to see some things around the Sláinte Care contract, like funding for research and clinical trials, and some of the things the consultants don't have access to at the moment. But that'll all be part of the talks. But to exactly your point, Deputy, at the same time as putting the Sláinte Care contract in place, hiring hopefully 600 new consultants this year, we're expanding the acute beds, the critical care beds, the community beds, the step down beds, the rehab beds. We're expanding the safe staffing model for nursing, and the whole point of this is to take the pressure off the system, so that our clinicians can do the job that they want to do, and they have access for their patients to be able to assess them when they need to assess them, diagnose them when they need to diagnose them, and then either treat them with drugs they need access to, or indeed operating theatres.
And I move on to a number of other issues, Minister. The cervical check tribunal. I put in a parliamentary question on this recently, and I got the cost back. But before I go into the costs of it, one of the responses, the most recent response I got back, was that there was 3 cases which have been referred to the tribunal, which to me seems quite low. Is that the most recent figure? Is it accurate? And if that's the case, is that something that concerns you, that the number is so low, that the take-up essentially is so low?
Thanks, Deputy. I'll get you the latest position. My understanding is that there have been more referrals than the 3. I know there's been a lot of interest has been expressed and questions have been asked by various of the legal teams representing the women and families involved. My view is that it is a far better option than the High Court. However, we have to respect the rights and the decisions of the women to use either the tribunal or the High Court, or indeed both, because as we're all aware, at any time during the tribunal, the women can elect to leave that and can go to the High Court instead.
But are you confident that more women will? Because, and I'm looking at the costs, and it's some of the costs seem strange to me. €140,000 for furnitures and fittings. And it also talks as well, and maybe you might be able to explain this to me, an art allowance. What's that for?
I'm not aware of the document you're looking at, but what I can say that is when we
It's a parliamentary question response, Minister. Sorry that I should have said that. I got back. It talks about an art allowance. It talks about construction fit-out costs, consultant fees, and then it breaks down some of the additional spend, including 140,000 on furniture and fittings. But I'm just looking at the art allowance, trying to figure out what that's about.
I'll get you a detailed note on that, but certainly the fixtures and fittings and the building costs, there was a significant amount of work done to make the tribunal COVID friendly. So we wanted to make sure that any women coming in, some of whom obviously could be immunocompromised, had the appropriate facilities. So for example, now the women or the families involved, they can do all of the proceedings from their own rooms. They don't have to go into the same rooms as the lab or indeed the state. So the work was done by the OPW to create a suitable environment in COVID-19, which a lot of the courts
I think that's right, Minister, and I think we'd all support that. You might just send me on that detailed note on it, which would be good. I've just 2 more questions left, Chair. The first, Minister, is, has a decision been made yet on the location of the major trauma centre for Dublin?
Yes, that was agreed by government today, and the major trauma centre is going to be in the Mater Hospital.
Mater Hospital, okay. And I just want to ask a question in relation to the National Maternity Hospital, and I discussed this with you in private recently as well, so it's useful to have the opportunity to put this in public as well. There is concerns in relation to the company which essentially owns the land. And my understanding is that it's a precursor to the Sisters of Charity. There are issues which are being raised and legitimately being raised in relation to the ownership, I suppose, of the actual hospital, and then what impact that will have in relation to the running of the hospital. So can I first of all ask you to address that point? And second of all, has the department at any time looked at actually purchasing the land? CPOing the land? Like, was that something that was possible? Because I'm assuming that would be one way to solve this issue and to make sure that it was fully in public ownership, both the building and the land, and fully managed by the HSE and the state.
Thanks, Deputy. To the first question around religious ethos, I can tell you very clearly my view is that there can be no imposition of any religious ethos and any impact that might have on services delivered in the hospital under any circumstances. That's an absolute red line. It cannot happen. I've looked into this in some detail, and I have assurances that the structure that is being put in place absolutely does not allow that to happen. However, I'm also aware that there are some very well-respected people who have a different view, and I know there was a meeting, I believe Deputy Shortall organised recently on that. So I would be very, very happy to ask the unit and ask the lawyers to look at all of that evidence, because I think we're all on the same page on this. This needs to be a public hospital that delivers the public services that the Government of Ireland and the HSE deems to be the right services.
And I just want to commend Deputy Shortall for the meeting that she organised, and an all-party delegation will be looking to meet with yourself. So these are important issues, Minister, that need to be answered. Just one final question, and you won't have the information at hand, I would imagine, but it's more a detailed note I'm looking for. Because we're looking at expenditure and we're looking at the estimates and the total spend in health, can you ask your officials to provide me with a briefing note on the total private spend in healthcare in our total public healthcare system? So, for example, total spend on outsourcing to the National Treatment Purchase Fund, the total spend, for example, on consultancy fees, but also in your briefing note, you talk about community beds being purchased privately. And then there's the whole issue of locum staff and agency staff. And it's too much to go into in this session. So can I ask, for the purposes of future sessions and future engagements, that breakdown could be given to? So it's what I might do is just send the Secretariat a note of exactly what I'm looking for, but I'm assuming you have a sense of it, and if that could be provided, Minister, as soon as possible. And thank you for your answers. I'll leave it at that, Chair.
Thanks very much. Cathal Crowes next.
Thank you, Chairperson. Minister, thank you for being here today at our Select Committee meeting and for your detailed overview and the material we were also circulated with yesterday. I appreciate that. I suppose, look, in a year of negatives, because COVID has been a major negative in everyone's life, it's good to see. I think we're coming to a point where it has become more manageable, and there's two trajectories almost at intersection point now: vaccines versus declining or at least levelling COVID rates. So hopefully there's a lot of hope, and I hope that Thursday will allow for a safe-ish reopening of the country, or at least the next step in that process. I think it's welcome as well that government has awarded an additional 4.03 billion to your whole budget, to your whole department's budget, on top of its 2020 allocation. I just wish to come at an angle that hasn't been covered thus far in the deliberations, because I think there's potentially another budgetary constraint in your department, that being the digital green certificate, which is being worked on at European level. And my understanding is that although it deals with international air travel, it will come under the remit of your department. There's a vote to happen on that in the European Parliament this week. We know that the technical spec of it was agreed yesterday and published by the European Commission. So it's very much, the meat is very much going in the bone. We're at the point very shortly where this will be put to each member state to ratify, and then to decide how they will implement it. There are, of course, three pillars to it. It'll certify those who've been vaccinated across Europe, those who have been PCR tested and who are negative at the time they present themselves at the departure gate at the airport. And it will also carry data relating to those who've recovered from COVID. I suppose what I really want to get to, Minister, is that the European Commission are intimating that there'll be a 6-week lead-in or implementation period. That concerns me a little bit, and that's come from Europe, but that concerns me because I don't think Ireland, being geographically peripheral, being a little bit more cut off from Europe now with our nearest neighbours having departed the European Union, it concerns me that that lead-in period could throw us a little bit off kilter with opportunities lost to other nations. So my question is, have we as a country, and has your department, I suppose, the finances at the moment allocated, given that we're talking about your budget for this year? Are there finances in place? But more importantly, is there a team? Is there a structure in place? Is there software in place? Is everything ready to roll as soon as the Digital Green Certificate is agreed by European heads of state, that we can implement it in Ireland?
Thanks for that, Deputy. The short answer is it will be. As with a lot of other countries, the technology is being developed in the background, and there's a coordinating role from the Commission in terms of making sure that it works interjurisdictionally. So, in other words, if an Irish citizen lands in Paris, that they could show a unique code on their phone that the French authorities can recognise as fully vaccinated, and similarly, people arriving in from member states here into one of our airports or ports, that we can recognise that. So that work's going on in the background. Very significant work has been done in Ireland on exactly this point. And certainly we're looking very favourably at participation in the Digital Green Cert. It'll be very, very welcome, because if it works as we want it to work and as the other European member states want it to work, for those who are exempted, so for fully vaccinated people, it will enable free travel in a way that just hasn't been possible since this virus arrived.
And can I ask, you couldn't believe half of what you read on Twitter. You probably couldn't even believe 1/10 of it, but there are some in the industry already speculating, even though the European Union is only starting to trickle out some detail here, there are already people speculating that Ireland could be a laggard in terms of implementing this and being able to be at the races with other European nations. So may I ask, Minister, will we, when it's agreed, be at the same pace as other nations in terms of rollout? And I think it's also important that a lead-in period is communicated to particularly the travel industry and aviation, because a lot of our pilots, cabin crew, they're out of hours, to use a parlance from their own profession. They need to go back to training. They need a lead-in period. So will we be able to provide a lead-in period, and will we be able to keep pace with other nations? I understand Greece, Spain, the Mediterranean countries are really eager to get this in place for their tourism market. Will we be able to keep that pace, and that we won't be laggards in that regard, Minister? Thank you.
Thanks, Deputy. The briefing I have is that we are on track to be able to join it at the same time as other member states. Yeah.
Good. No, that's really welcome. If I can also then continue on the European vein, and I've spoken on this in the Dáil Chamber quite recently. You, of course, lead up the Department of Health, and you meet with your counterparts and colleagues across Europe on a regular basis. And ultimately, whilst we have our own structures in Ireland, there is the European Centre for Disease Control and Prevention. And I presume, as a member state of the European Union, we're also contributing, I imagine, financially to that. They have a budget of in around 50 million per year, which is paltry, considering that their American equivalent has an annual budget of 12 billion. There's not much you can do in this regard, but I ask that at the next Council of Ministers that you would be an objecting voice, or at least a voice of concern in the room, that this entity, which was set up 18 years ago at the outbreak of the first ever SARS disease, that it has proven itself to be largely inept and ineffective. They are ultimately the source of information for each member state to have its own trickle down of policies in terms of managing this. Do they interact with you much? Are you concerned as a block of ministers that they haven't been that real steady backbone that you would have needed them to be for the last 14 months?
Thanks, Deputy. Certainly at a European health minister level, I think there's a very clear understanding that whatever systems we have in place to deal with pandemics, be it the ECDC, the European Medicines Agency, or other groups, that there is significant investment required. And we know that in Ireland, regardless of what happens at a European institution level, there is significant investment required. The public health system here was not fit for purpose in terms of dealing with a global pandemic. We should have, and now will have, a consultant-led public health system. We need a much expanded public health system, which we're now doubling, as you'll be aware. And we also need much better IT systems. We need to move on some of the other things that they're not just public health and pandemic related, but indeed we're right through this launch care system, like unique patient identifiers. We are laggards on e-health, and that has to change. and there's significant investment going in, significant work going on to that end. When it comes to the ECDC, what I can tell you is that the public health teams certainly rate their advice very highly. So NEFIT will regularly refer to and interact with ECDC in terms of international comparative analysis around public health and around COVID-19. But I think the core point you make, do the European institutions need to be further enhanced? I certainly would be supportive of that, yeah.
Thanks, Minister. I'm going to end on that note on e-health because I want to ask a final question in that regard. If we're going so far as a nation in the coming weeks, so there's a little bit of unknown here, and yet the details starting to come from the European Commission, we're going to have an e-health system. It's probably going to be on our phones. It might be like what we saw a few weeks ago on the primetime special, where we saw a little snippet of people going around Tel Aviv and Jerusalem and Israel, and they had little digital certificates on their phones going into cinemas, pubs, restaurants, and it was their passports to entry. If we're going the whole hog in terms of having a digital system in place to allow one to present themselves at an airport departure gate, would your department consider having that system, which will be up and running, that system could also be operational in certain contexts around the country, allowing people potentially to go to matches, concerts, weddings, I don't know, just large congregating venues, that if we have this system in place, that we would give it a dual purpose and use it on the domestic front, not just at the airport departure gate, but domestically, like Israel and some other countries have done too. Because if we're going that whole hog in terms of software and smart and e-health infrastructure, I think it would be great if it's a device in your pocket, you can pull out and show it somewhere. Has there been any talk of that within your department, of having a deeper role for that kind of technology in the months ahead?
Thanks, Deputy. Certainly the principle is already enshrined in the regulations in terms of being able to exempt from mandatory hotel quarantine and move to home quarantine, for example, if you can show that you're fully vaccinated, and the EU Digital Green Certificate is built on that exact premise. That there are things you can do because you pose less of a risk to other people. It is less about protecting the individual and more about protecting other people from international travel. When it comes to domestic measures, really there's a philosophical question to be discussed, and I'd be very interested to get the committee's view on it, which is it right or proper to discriminate in terms of access to domestic services, as you say, be it a concert or be it something else, based on whether somebody is vaccinated or not. I think there are quite strongly held views on both sides of that argument. I'd be very interested if the committee were to discuss it, to get a view from the committee. And also the same question would have to be applied to the legality of it in terms of creating different levels of access for people based on the situation you described.
Sure. Thanks, Minister. I appreciate your time. Thanks, Chairperson. I'm finished with my questions.
Thanks very much. And we sort of drifted away from some of the things, Minister, you're asking us, would we have a look at a particular area? But you might come back to us as a committee at some stage that, particularly for someone who's travelling that had COVID, and one of the requirements at the moment, of course, is that you need a PCR test. But I'm told that if you've had COVID within a certain period, the PCR test is going to come back as that you're positive. So it's some of the difficulties that I personally have been dealing with, some cases of people that recently were quarantined on the basis of, that was one of the reasons why they were quarantined, that they didn't have a PCR test, but they'd been told by your department officials that it wasn't needed. So it might be something you could look at and come back to as a committee at some stage. Our next question here is Roisin Shortall. Roisin, you're very welcome.
Thank you, Chair, and thanks, Minister, and your officials for the very detailed briefing that you've provided. I'd just like to talk about the reform programme and just where we are in relation to elements of that. But before I do, I just want to go back to that issue raised by Deputy Cullinan in relation to the new National Maternity Hospital. And as you say, there was a very well attended briefing yesterday on that, and it's true to say that there's a lot of concern about the fact that the new entity that has been created to replace St Vincent's Hospital Group, known as St Vincent's Holdings, is actually operating on the same ethical on the basis of the same ethical code as St Vincent's healthcare group, and that the constitution hasn't been changed, and there's concern about all of the implications of that for women's healthcare and services that should be provided in a publicly owned hospital, as well as the question of handing over or gifting a publicly funded hospital to a private entity. So there is a cross-party group that has been formed. There's an email on its way to you today requesting an early meeting on that before any final decisions are taken. And I would hope that you'd be in a position to accede to that request for a meeting, and that we could do that at an early date. So I hope you're agreeable to that, Minister.
Thanks, Deputy. Yes, absolutely. And can I just restate? Essentially, this all boils down to a question of, could services that must be provided for women be stopped because of a religious ethos? That really is what this boils down to, because we know that has influenced things in the past. My unambiguous position on this is that will not be allowed to happen. I've sought assurances that is the case based on the new governance structure. I have absolutely clear assurance that is the case. However, I know that you've convened a meeting of very smart, very informed people who have a different view. So if you, and maybe it's in the email you're sending, so can I suggest two things? First of all, send on whatever their view is, and I'll ask for a response from the department and from the legal teams on that, and then I'll send that back to you, and then let's meet up, because there can be no question of any services for women being stopped or watered down or anything else because of any ethos. The government and the HSE will decide, and that can be the only way we proceed.
Okay, just I don't know if you're aware of it, Minister, but currently reproductive health services are not provided to women in St Vincent's Hospital, and it's hard to see how, given the expected structure of the new company and the basis of it and its origins, that situation would change, and particularly in the context of the repeal of the 8th Amendment. But other, basic services like sterilisation services, prescribing of contraception and so on, very basic women's health services that are currently not provided in that hospital. So it is a matter of concern. So I look forward to engaging with you.
I will, and I can tell you there will be no hospital created or put in place that denies women access to any of those services. And I'd be very happy to engage in a lot of detail to make sure that all of the issues are addressed.
Okay, thank you for that. So look, in relation to the whole question of expanding services and dealing with the issues that are there in relation to recruitment difficulties and retention difficulties, I think that is a very pressing issue right across the health service in all kinds of disciplines. And I'm just wondering, at what level is it in the department or in the HSE? Is there work going on to do that essential forward planning to ensure that, first of all, our colleges have enough places to train people that will be needed over the coming years, and also that we address the kind of issues that lead to people leaving this country rather than staying on and working in the Irish Health Service. So where is there work being done on that?
The short answer is yes. So there's a new team was set up last year called the Workforce Planning Unit, and this is exactly what they're looking at. So Laura McGahey, as you know, leads the Sláinte Care team. One of the things they're doing is the area-based analysis to say how many of each specialty do we need in all the areas, and that will give us the gap, and that allows us to hire in. But at the same time, the whole pipeline of people coming in is being looked at. So different nursing specialties, different medical specialties, different health and social care specialties. How many of these people do we need? How many training places are there? How many can we retain here, and so forth?
Okay, sorry, I take it that it's not the Sláinte Care team that's doing that work, is it? Is there a separate unit in your department?
That's right. The Sláinte Care team is doing the area-based analysis.
Yeah.
And then there's a different team, which is the workforce planning team.
Okay, and do you expect that team to report soon?
They're reporting on an ongoing basis, so there's not a big single report that they're doing. So they're looking profession by profession and working their way through it. So they'd be in regular contact, for example, with higher education on places that need to be made available.
Okay, I just wonder if it'd be possible for that group to provide an update to the committee, because we were talking earlier that this is one of the issues which we intend looking at.
Yeah, no problem. I'll ask for an update for the committee.
Thank you. Just picking up on that issue of the Scoliosis recommendation on 3 elective hospitals, and it's disappointing to hear that seems to be a watering down of that. I mean, this was a key recommendation following on from the experience in Scotland in relation to how they dealt with pressures on their acute hospital sector. And, you know, there's a very, very strong case for having elective hospitals, but they have to go beyond day cases. Obviously, they could do day cases, but there's a need for inpatient cases as well. And for example, one of the key pressure areas is the whole area of orthopedics. And, you know, that's something that should be done as a matter of course, in and out in a matter of days, as some of the private clinics are doing very successfully. And what was done in Scotland was a private hospital was actually bought to kickstart that whole new approach. And I'm just wondering if consideration has been given to that. And I would also urge you to ensure that we're not just talking about day hospitals, that it is full inpatient hospitals.
Thanks, Deputy. I think it was Glasgow, wasn't it, where they bought a private hospital, and I think they bought the hotel beside it as well, so that people could be rested and prepared. So what I can tell you is that it's actually the Sláinte Care team that's doing the elective hospital work, and their thinking is around the day case, and it's not because we don't need more inpatient beds. We all know we do. It really is around providing the most effective healthcare possible. And part of the thinking is, first of all, separated from emergency departments. So it's planned, it's elective care only, so it doesn't get disrupted by emergencies coming in. So physically separated, like Tala, for example, are doing their unit. Sure. And secondly, their thinking is that if you create it as day case, it's not that you're not creating additional inpatient beds. What you're doing is you're pulling the less complex care out of the bigger Model 4 hospitals. Yeah. And they can, of course, they can turn some of their day case into inpatient. However, I think it's worth reiterating, as I did to Deputy Burke, that no final decisions have been made on that, and I'll certainly feed your view and Deputy Burke's view into the team that are looking at that. And as I was saying, I know there are strongly held views both in the community and clinical communities in Cork and Galway that the elective hospital needs to be day case and inpatient.
Yes. Okay. Thank you. Just again in relation to 2 key elements of Sláinte Care, and improving access and removing cost as a barrier. Where do things stand at the moment in relation to the extension of free GP care for children? And when can we expect children up to 12 to have access to free GP care? That's the first question. And the second question is in relation to e-health. And I think the experience over the past year has just shown the huge weaknesses in terms of hugely underdeveloped e-health provision within the HSE. Over what period would you expect to implement the full existing e-health programme that was developed a few years ago? So those 2 questions, please.
Thank you, Deputy. So on the increase in eligibility, essentially the reduction in cost, we increased GP care last year. There are no plans to increase that further this year. However, there are plans in further years to do so. And I'm sorry, the second part of your question, Deputy, was
in relation to e-health.
Yeah, so there's 2 big budgets. There's a new budget of €58 million, and that is looking partly at what you've referenced, which is Ehealth Innovation. So obviously telemedicine was a huge success as part of the COVID response. So we're looking to put that on a permanent footing. But there's also some really exciting things happening. There's pilots going on around the system, things like remote sensors for people at home. So as we move the chronic disease management.
I appreciate that, Minister. Sorry to cut across you there. But I mean, there was an e-health programme drawn up. And the price tag of that was, I think it was 850 million euro. to be developed over a number of years. The original plan was to implement it over 15 years. Sláintecare recommended, given that it's so critical to the efficient delivery of healthcare, that it should be implemented over a 5-year period. Now, where do we stand in relation to that plan?
Let me get you an update on that. What I can tell you is that in the estimates we're looking at right now, there are two pieces. There's the 58 million for eHealth, for innovation, for the new things, and then there's money and capital as well for the backbone, for the infrastructure, things like unique patient identifiers, making sure the GP systems talk to the local acute systems, or indeed all of the acute systems. So there's a total within the budget, the figures we're looking at, of 255 million euro. So I was very conscious of that figure you've referenced as well, which was an enormous figure as part of the Sláintecare around creating a backbone. So the total we're looking at now is 255 million euro annual funding for health ICT just in this budget. So that is about building the backbone you're talking about, and the 58 million is around innovation, chronic disease management in the community and so forth.
I'd appreciate a note, Minister, on the time scale for the implementation of the full eHealth plan.
Yeah, no problem.
Okay, thank you. My time up?
Yeah, its time is up, Roisin, sorry.
Okay, thank you.
Okay, thanks very much. Now we have Gino Kenny.
Thank you, Chair, and thanks, Minister, for your overall view of the health budget. I think obviously last year was an annus horribilis in relation to our health budget, and this year it'll probably be a bit the same. Just in relation to some of the positive news, Minister, in relation to women's health task force, I think it's very welcome in relation to funding, in relation to the expansion of the endometriosis service in Tallaght. That's very, very welcome, and that's a very, very positive thing. Just for clarity, in relation to the financial position, the 1.07.4 billion capital expenditure, is that capital expenditure spent on PPE last year in relation to the pandemic? So that's my first question. Actually, you may be able to kind of just explain the kind of that capital expenditure. What was that for? Awesome.
Minister, we can't hear you.
Gotcha. Sorry,
Okay.
folks. Thanks, Deputy Kenny. So the capital funding is right through the budget. There's two big pieces. There's the COVID funding, and then there's the non-COVID funding. So the COVID new measures is 2.121 billion euro, and there's a capital allocation in that of 155 million euro. And then obviously there's the new measures of 1.163 billion, and the capital funding in there is an additional 13 million euro. The capital funding is right through the programme. So if you take the non-COVID care, for example, there's capital funding in the 276 million that Deputy Cullinan and I were talking about. That's 236 million current expenditure, which is the money to fund the teams, the staff, the nurses, the doctors and so forth. And then there's 40 million capital funding in there. The same for critical care, subacute beds, community beds. On eHealth, as Deputy Shortall and I were just talking about, there is both current and capital funding, but the eHealth, the 255, a good portion of that is ICT infrastructure, which is capital funding. So if you like, what I can do, Deputy, is get you a breakdown line item by line item as to exactly which is capital and which is current in a programmatic way. So the way we're all presented with the figures for legacy reasons isn't very helpful in terms of breaking out the capital. We get a capital line item, but really what we need to know, I think, which is to your question, is how is that capital line item allocated according to the different programme areas: acute care, community care, eHealth and so forth. So if you like, I'll get you a detailed note on exactly how that capital funding works across the programme areas.
Okay. So my second question is in relation to allocation of funding for eating disorders. Obviously the pandemic has compounded a lot of issues in relation to mental health, particularly around eating disorders. And I understand that, you know, the programme that was set up in 2018, the National Clinical Programme for Eating Disorders, had a certain budget. Now, in previous years, that budget was kind of underspent. That would seem kind of extraordinary, really. And it seems, where I can gather, is that there's a current underspend at this particular time, particularly with the rollout of the particular programme. So, is that money ring-fenced for the programme itself, particularly around the hubs that was stipulated under the kind of the programme? But maybe you can comment on the underfunding of particularly around eating disorders.
Thanks very much, Deputy. Yeah, and can I share your concern? No doubt, the same as yourself. I've been talking to some of the mental health clinicians, but also to teachers and school principals and parents. And one of the things that they have seen spike during the pandemic, very worryingly, it is said to me regularly, is eating disorders among younger people, and particularly among younger women and girls. And it is really concerning. So in terms of the numbers in front of us, we have a very significant increase in mental health funding, and I'll come to how eating disorders is dealt with within that. So the total increase in mental health is €83.2 million. It's the 23 million in new measures. It's the 15 million in COVID-19 programs, but also there's something that has kind of been below the radar. It's some people would see it as a technical adjustment, but actually it's hugely important to getting the mental health services running. Is there's 45.2 million has also been allocated in existing level of service, pay rate funding and technical adjustments. Essentially, the HSE has maintained a position for the last few years, as you'll be aware, where they said they couldn't provide the new services because they weren't getting a sufficient increase in their base funding for the existing services, which is covered under ELS, or existing level of service. So we've put a huge amount of funding this year into ELS to cover the increases required for this year, but also an historic deficit. And so this year we really need to see the health service providers stepping up and saying, we're adding all the new services. So then specifically around CAMS, there's a few different things happening, Deputy. So we've new CAMS staff funded. We've an increase in the CAMS community mental health budget by 10% nationally on last year, which is important. So that's both assessment and treatment. We've 3 new CAMS telehubs nationally, going back to the conversation on Ehealth. We've a new high dependency unit in CAMS in Galway, which is going to commence construction later on this year, which is very, very welcome. And then there's additional bed capacity being put in place. So then specifically to progressing the specialist mental health programs, 4 of them that are getting particular attention are dual diagnosis. There's a real problem with dual diagnosis where mental health are saying, we can't treat this person because they're an addiction. Addiction services are saying we can't treat this person because they have mental health issues, and so we're cracking that nut because people are being failed who fall into the dual diagnosis, which is quite a lot of people. Early intervention in psychosis, eating disorders, and then the mental health, intellectual disability. So I fully agree with you. It's a big focus. It's become a real problem during the pandemic, and we're funding to scale up in terms of staff, early assessment, treatment, beds, and community healthcare provision.
Okay, thanks, Minister. Just another question, Minister, is in relation to, I'm not sure you'll have the kind of very finer detail in relation to this, is in relation to the rollout of the medical cannabis access programme. Now, I did look at the estimates, but I couldn't find an allocated budget for the programme, and I understand that the programme will commence sometime in June. Is there a kind of a budget for the programme in the next, obviously it's a 5-year pilot project, but is there a kind of an annual budget, and where kind of where are we at in relation to the programme commencing?
Thanks very much for that, Deputy. So yes is the answer. So we've allocated funding for Mcapp for this year for the first time. So as you'll be very aware, you've been a very strong advocate for this. The Mcapp programme has been in place for some time, but there's never been any funding for it. So this year, out of the new drugs budget, we're allocating several million euro. We have to wait to see what the uptake is, obviously, but several million euro so that it's now a funded programme. I'm aware, as you are, that there are some drugs, including Bedrocan, for example, which aren't on that programme. And while a lot of progress has been made, more progress is needed. So as we'll all be aware, on some of the products like Bedrocan, which fall outside Mcapp, those who are using them, or indeed their parents, are in a very unenviable position, an unacceptable position, whereby they're having to pay for the drugs up front and then be reimbursed for them on a monthly basis, and it's a huge amount of money. So I've asked the department to find a way to deal with this. One of the issues we have on Bedrocan, unfortunately, is around exporting from Holland. It's not that we don't want to do it. There are just international constraints, and we're working through them. But I'm very aware that the Mcapp programme is going to be very useful for people. We've put a multi-million euro funding package in place, and there are other outstanding issues like the one I've just discussed, which are causing real difficulty for people, difficulty they shouldn't be having to experience. And I'm working in the background with the department to put solutions in place for that.
Thanks. I think that's it. Thanks.
Okay, thanks very much. Minister, I have just a couple of questions myself. One is in relation to the National Children's Hospital. It hasn't been touched on today, but do we know how much it will actually cost? We've earlier in the year we had people off the board coming in to outline some of the difficulties that they've experienced there. So we know that there's compensation claims coming through the courts and so on. The building was closed for a period and so on. So I'm just wondering, do we have a ballpark figure? Do you know exactly how much it's actually going to cost? It's part of, it'll be a big figure in relation to your estimates. Maybe I'll just go on to a couple of other questions if you need time for that one. Just on the whole issue of long-term COVID, and again, I'm not raising this to frighten people, but I think there's a conversation needed around this whole area of people having difficulties, vaccine-associated illnesses in relation to the COVID vaccines. Currently, I'm dealing with 2 cases in my own constituency in relation to vaccine-related clotting, or VPIT, and this has required blood tests, treatment, in-stay beds, medication, and inability to work. One developed clotting on the brain, and again, I believe that there needs to be a conversation around this. But what they would say to me is that there'd been a significant amount of money being, they're getting bills now after being released from hospital. They're still in hospital care, and they're worried about, they've been out of work, out of job. They're worried about mortgages. There's 2 women in their 30s, so it's a big. So if you get a bill for €1,000 or something, from hospital aid, it's a lot of funding. So I think it's only right that we have some sort of support scheme in place for costs occurred from side effects of the vaccine. Now, I did ask recently PQ on the matter, and you said that your department said that there was policy development in this regard underway. I'm just wondering, has any amount been set aside in the health budget for vaccine-related costs incurred by people who have been vaccinated and suffered side effects? We know that, the state has indemnified many of the manufacturers and so on. And again, just to go back to, you were talking earlier about, quarantine and so on. I'm told that there's an avalanche of cases waiting in relation to the quarantine and so on. And again, I'm just wondering, do you have, is there funding set aside in relation to that? Are you worried about that coming down the track? The funding for local drug task force, Again, I'm someone that's been on my own local drug tasks, I think, practically since they were established, but I suppose every year, you know, we look for funding and so on. I suppose the big challenge this year for many communities, and particularly in the Dublin area, but it's going to, you know, it's going to spread to other areas, is the rise in crack cocaine and the impact that that's actually having on communities. In November 2020, there was a once-off funding bump of 480,000 for the whole estate. This worked out about roughly 20,000 per area, which is a drop in the ocean. We know the challenges it's facing people out there. People mentioned earlier on about the impact of COVID, and it's you know, it's impacting on people that you know, have difficulties with relation to substances, whether it's drugs or alcohol. So again, is there, you know, have you looked at this possibility of increased funding for those projects for vulnerable people that are in many of those communities? Just on that, aside from that, Minister, you know, there's two projects I'm not aware of. St. Michael's in Beaumont Hospital is being closed during COVID. Again, you know, would have supplied very valuable work the north side of the city, and the closure then of residential beds and support services in Gentoy in the Phoenix Park then, again, having a big difficulty, and it's one of the issues that keeps coming up at task force, not only a funding issue, but, you know, the residential beds and so on. So again, have you talked to the Junior Minister in relation to this? Because I know he's been out in some communities looking at the challenges that's been facing there. When we had you in before, we asked about the whole issue of scoliosis and the backlog there, and particularly waiting lists. And again, has there been funding identified within your estimate this year for that particular group of many young children that are, you know, suffering horrible, you know, the effects of scoliosis, as you're more than aware of, on their, you know, their young bodies, and the fact that they could be left with deformities for the rest of their life if they're not dealt with sooner rather than later. And you talked in terms of, you know, there was difficulties in relation to Crumlin Hospital and MRI and staffing of the MRI machine and so on. We had recently again as a committee the Irish Dental Association in, and they talked about hundreds actually leaving the medical card scheme. And again, I'm just wondering, they were concerned about, you know, the fact that, you know, there hadn't been talks resumed and that. But is there funding set aside for in the estimates again for a possible deal in relation to that? One of the positive things that this committee has done in recent times is a report on vitamin D and you know, the impact of COVID, but also on general health. And we proposed, you know, we're looking at areas like nursing homes, but also frontline staff, possibly looking at areas of, you know, high COVID, you know, outbreaks, and the whole role of vitamin D in building up people's immune system. And I know there's been a report in your own department. It wouldn't go as far as our own in relation to the age group. You know, the cohort we were talking was much younger. But again, is there funding in relation to that? And I suppose lastly, just there's a number of questions there, Minister. If you can't come back to us today, maybe you come back to us in the future. But you know, I just think there's some of the big issues that are still outstanding in relation to certainly some of the work that this committee is doing. So I'll leave it up to yourself, Minister, if you can reply to some of them.
Absolutely, and thank you very much for all of the questions, Chair. With regard to the Children's Hospital, the capital budget, as the committee will be aware, including the 3 satellites, is 1.433 billion, and then there's the commissioning costs on top of that. But to your point, it doesn't take into account the impact of COVID-19. It wouldn't be appropriate for me to speculate at this time as to what that might cost, because it will be the subject of ongoing negotiation between the board and the contractor. In terms of long COVID, I fully agree, and you know, there's a really important message that we need to get out to people, particularly now as we see the case numbers beginning to tip up again, which is, even though those who are younger are significantly less likely to fall seriously ill or die from COVID. There are emerging cases, and it's really quite concerning in some cases, of the impacts of long COVID on all age groups. You've referenced several cases yourself. I'm aware of research looking at potentially permanent neurological damage, looking at permanent damage to the heart muscle. And part of the message we really need to get out while we're still in the gap between the most vulnerable people being vaccinated, but not everybody being vaccinated yet, is that even if you are in a relatively safe category in terms of fatalities, what you've just referenced, Chair, in terms of long COVID is very, very serious, and there are people of all age groups who are taking months and months and months to recover from COVID and who are just exhausted. It is something that's being looked at. There isn't explicit money ring-fenced for it, Chair, but there is a pretty substantial contingency fund related to COVID in place, and that can be tapped into. And certainly I can tell you the government will not be found wanting in terms of the research and the treatment and the supports required for that. On mandatory hotel quarantine
Sorry,
cases,
Minister, just on the vaccine related, again, it's, it's related to the long COVID, but it's, it's vaccine related illnesses as well. Again, I don't know if there's huge amounts, but, we're all hearing anecdotal stories that, it had side effects, and it's bound to happen no matter what vaccine is going to be handed out to people, that there's going to be some have a negative effect. And again, I'm just wondering, is there going to be supports there for people in that situation?
I think we'll need to see how that evolves, Chair, to be honest. The position right now is that the vaccines are incredibly effective and really very, very safe. There are side effects, as you quite rightly say, within the normal parameters of people being vaccinated, and for the moment that's the focus. In terms of hotel quarantine cases, yeah, we are aware of a number of challenges. Now, I can share with the committee that when the additional exemptions were put in place, particularly around those being fully vaccinated, quite a few of the potential cases fell away. There's exemptions in place, as people will be aware, around the fully vaccinated, and indeed around exemptions, for example, for professional, and elite sports. The cases are being fought at the moment in the normal way, but again, there is quite a substantial contingency fund in place for COVID-related issues, and so I wouldn't anticipate seeking additional funding from the Oireachtas this year for those issues. Chair, on the local drugs task force, can I just say that I could not agree more. I met in Ballymun last year with the local drug task force earlier on in the year, and the stories that they told about the impact crack cocaine was having on the community were just horrifying. We're seeing it in parts of Wicklow as well, and those working in addiction services and the drug task force there are watching it very closely, and they're very, very concerned by it. The team that I met in Ballymun, a lot of the people I met were involved in the response to the heroin epidemic, and they are hardened, seasoned professionals, and they said that they had never seen anything like crack cocaine and the damage that crack cocaine is doing. Minister Fian, as you're aware and as you referenced, is leading on this area, and a very sizable additional fund has been provided, both in terms of Healthy Ireland, homelessness and addiction services, and it's certainly something that I want to see more and more and more done. And there's other things we're trying to fix in the background, Chair. So for example, if you are living in somewhere in Ireland and you're in addiction, there's a fair chance you'll have rent allowance or a rent supplement, for example. If you move into a residential addiction program, you lose that. One of the things we're trying to do is have a more coordinated approach from the state. So, for example, if that funding can be transferred to the addiction service providers, more and more people can get addiction help. But I just couldn't agree more strongly with you, Chair, in terms of the need to fund and increase capacity for the local drug task forces, but also for the myriad of services around that, so that we can treat addiction as a health rather than a criminal issue, which is exactly what we want to do. The next one, Chair, you referenced is scoliosis. The current situation is not acceptable. So in last month, on the 26th of March of this year, there were 119 patients waiting on spinal fusion, excluding the suspensions. And that's an increase of 20 patients compared to March 2020. Now, we know that a lot of the waiting lists have gone up because of COVID and the suspension of some surgery, but there were 70 patients on the waiting list for other spinal procedures, which is a decrease against March 2020. But nonetheless, the current waiting times for scoliosis, if you need to go through the public system, they are not acceptable. And it is one of the areas that we are looking at as we put the detailed planning together around the Access to Care Fund. It's something that I think all of us who are health spokespeople, who've been involved in the Healthcare Committee, we're all acutely aware of the untold suffering of young men and women and boys and girls, and the awful implications of having to wait. I don't believe it's acceptable. There is going to be money available, and we are going to crack this so that on the public system, that these young men and women and these boys and girls get not just the care that they need, but they get the care they need when they need it. Your next one was dentists. I might get you a briefing note on that. It's not related to the estimates today, but I'll get you a detailed note. But I am aware, as you referenced, Chair, that the association have said that more and more of their members are leaving the public list. Now, that's not something that we want, obviously. Again, everything we're doing is about building up our public health system and increasing access. And there's no question but that in the area of oral health, there are very significant financial barriers in place, and they're not acceptable, and they needed to be acted on. Vitamin D, I saw the report. I thought it was excellent, and really all I can do is agree with you. I asked for a review on the back of the report from the committee from NEFIT in terms of vitamin D and COVID, and what they came back with was an answer that said they didn't have evidence of a reduction in risk specifically to COVID, but they wholeheartedly endorsed vitamin D and the right amount of vitamin D being taken for general well-being and a strong immune system.
Okay, thank you, Minister. There's a couple of other members trying to get back in. Bernard Dorkin is next, and I think Roisin is a question as well. Bernard's gone. Roisin, are you still there? Get in before Bernard Dorkin, before he comes back.
Yeah, I was given away to Bernard.
He's off the phone, so
okay.
Go ahead.
Okay, right. Just two very quick, or three further questions. Just, Minister, on the extension of free GP care, you're saying there's nothing proposed on that this year. That's kind of quite disappointing, given that, you know, over a 5-year period, there was to be an incremental extension of free GP care to everybody across the population. We're probably the only country in Europe where the majority of patients have to fork out the full cost of visiting a GP, and that very much goes against the principles in Sláinte care of early intervention and, you know, lowest complexity of care. And I think that's a mistake not to accelerate that. And I know there are IR issues, but I would urge you to revisit that issue and try and accelerate the extension of free GP care, because it makes sense on a whole lot of different levels. I have two questions then, just in relation to drug costs. Are you doing anything specific to reduce the level of drug costs in this country for the state and for individuals? Because as a proportion of the overall spend on health, it does seem to be much higher than most other European countries. And we know when people used to go abroad that the cost of medicine are so much cheaper. So what is actually happening on that? Because it's not a sustainable amount our percentage to be spending on drugs. And my last question then relates to the proposed restructuring and reform of the HSE. I know that was parked for a while last year with all that was going on, but where are we at on that at the moment? And when would you expect recommendations and action to be taken on restructuring the HSE to make it more responsive and to make it more accountable at a regional level? Thanks.
Thanks very much for those questions, Deputy. On universal access to primary care, including free GP care, I agree. And it is worth saying that the measures we brought in towards the end of last year did increase the total number by several 100,000 children. I know you were critical of it at the time, as obviously as you're right, because you want more to happen faster. But I certainly think we added, I'll look for the figure, but it was several 100,000 children were being added. So I think that, look, it is a very serious step in the right direction. One of the issues you'll be aware of is we've got to have the capacity in primary care for this. And we're asking a lot of the GPs at the moment. Obviously, they've been instrumental in the test and trace system. They've been instrumental in the vaccine program. We're asking for pretty fundamental reform in terms of the chronic disease management in the community. We've got rid of the dot matrix printers for prescriptions on the public list system, which they're very happy about. There's a big, they're very happy about the access to diagnostics in the community. So I know you understand this very, very well. I'd like to see it move as quickly as possible. We increased it by several 100,000 last year, but we have to make sure the capacity is there as well. But your point is very fair. We are signed up to universal healthcare, and that's exactly what we need. And as you say, we are an outlier. In terms of drug costs, there are two things I'd point to. One is the new drug budget. So that's €50 million. It was zero last year, so it's a very, very sizable increase. There is a backlog of drugs from last year, which are being moved through at pace by the HSE at the moment. So that 50 million it's not that it will reduce the drug costs, but it will provide for free, because it'll be through the public system, some very new drugs, and then existing drugs for new treatments, which will help. And then specifically to prescription charges. So from November of last year, so in the budget in front of us now, there's €45 million specifically to this. So for prescription charges for the over 70s, it reduced the charge from €1.50 to €1 an item, and for the under 70s from €2 to €1.50. The net effect is it's believed it'll benefit over 1.5 million people with medical card eligibility. And the drug payment scheme threshold reduces from €124 to €114. So it's a €45 million step in the right direction. The question on restructuring is probably a longer conversation than we have time for now. But I took a decision last year that during the pandemic, it was not the right time to move to the regional structures. Not that they're not the right way to go. There's a lot of work has been done on them, and I think we're all broadly in agreement on the single biggest advantage, which essentially is joining up the budgets for acute care and community care, because that's one of the big problems, is this silo budgeted activity that we have. I took a call that the pandemic was not the right time to do this. I think based on what's happened over the last year, I think that was probably the right call. What we haven't answered yet, I think, is the question that you're now posing, which is, okay, but please God, the pandemic will be behind us soon enough. So do we have a time when we will move to those? We don't have a time, but I can tell you that people who are involved and very bought into it are already agitating for us to begin moving in that direction again.
Okay, thank you.
Okay, so thanks very much. Minister, do you want any concluding remarks?
Thanks, Chair. Well, really to just thank the committee for their time and for their questions and for their ideas. And I think there's several pieces of follow-up work that we'll do, be it on the National Maternity Hospital and various technical notes that people have. Look, my view is that this is a really exciting budget. It's a lot of money. There's a lot of technical stuff going on in the background in terms of financial reporting and IT systems and e-health and enablers. But ultimately, there's a few really exciting things happening in this budget. The first is around beds. It's a massive increase in beds. It's about 342 million in terms of acute beds, critical care beds, subacute beds, and community beds. They'll make an enormous difference, and they catch us up on the 2018 capacity review. So that's the first big chunk of investment, is around building out the capacity. And obviously that funding, it isn't just for the physical beds. That's arguably the easy bit. It's the staff and all of the professionals we put around it. The second then is what I think is an unprecedented investment in community and social care. And this is the big structural change piece. So we've 408 million going into this. It's home care packages, it's the community health networks and community specialist teams, it's GP access to diagnostics, and then some of the things that Deputy Shortall and I were just talking about in terms of reducing the costs of access to care. There's huge funding is going into additional funding into disabilities and mental health, something I know that everyone on the committee is really, really committed to. And then there's a new piece which I'm really excited by, which is it's nearly 150 million for the national strategies. So, for example, just before we sat down, I sat down with the committee. I came from meeting the people who were involved in the National Trauma Centre strategy. A lot of funding is now being provided that, but also funding for maternity care, a lot of funding for women's health, paediatrics, dementia, palliative care, the carer strategy, positive ageing, the various clinical leads and clinical groups across the system in these really, really important care pathways have got the funding to implement some really wonderful strategies that have been put in place in recent years. There's a big investment in terms of public health and well-being. In your question, Chair, around the national drug strategy that comes to 53 million. There's the new drugs and various things we discussed. And then there's a really important piece, which is the Access to Care Fund, which will be the 130 million from the NTPF, an additional 210 million, which is a new allocation, and then the alternative care pathways, screening and hospital restart grants, which bring us to in excess of 400 million euro, which we need to tackle these waiting lists. I would just say to the committee, we've probably set really ambitious targets right across the board. We will hit as many of them as we can. It's entirely possible we won't hit them all. We've set really demanding targets in so many different ways, and all of our amazing clinicians obviously have been working flat out, and quite frankly are exhausted from the pandemic and from all of the additional work they've had to do in the pandemic. So the budget in front of us is really exciting, because I think it begins to it's allocating money in new ways, be it the national strategies or the community and care services, as well as building up the acute services as well. But I guess I would ask for the committee's patience and understanding as we try to hit all of these targets, ultimately to make things better for patients, better for the public in the year we're having. And with our amazing clinicians and non-clinical staff right across the system. They're working so hard, they are so tired, they've done such an incredible job. And as the pandemic dies down now, the focus quite rightly from the committee, from me, from the Oireachtas and from our health service itself and from the department will be on all of these wonderful areas and getting them going. So thank you very much, Chair.
Thank you. So that concludes the consideration of the 2021 revised estimates for vote 38 for the Department of Health. In accordance with Standing Order 101, a message to that effect will be sent to the Clerk of the Dáil. Again, I would like to thank the Minister and his officials for attending our meeting here.